Hello my dear student, hope you are fine and safe at your home. Today I am going to describe about different types of circulatory disease and their remedies. Hope you will enjoy this class. After watching this class, if you have any question about your syllabus, so please write down on comment box. I will try to give your answer as soon as possible. Welcome again. Hello my dear student, now I am going to describe about circulatory related diseases and their remedies. First of all, heart attack or heart failure. There has a significant difference according to your syllabus. Now I am going to describe heart attack. Okay. An acute myocardial infarction, also called a heart attack, happens when a blood vessel in the heart suddenly becomes blocked. Blood vessel carry blood and oxygen. When a blood vessel in the heart get blocked, blood cannot get to part of the heart. This part of the heart does not get enough oxygen. This is called ischemia. When the heart muscles becomes ischemic, the ischemia often causes chest pain. This is called angina pectoris. So a heart attack is a medical emergency. The first few minutes are very important to keep the person alive. Some of the damage from the heart attack can be repaired if the person gets treatment during the first hour of attack. So this is a very important fact. Okay, there is a different causes by coronary arteries diseases. In coronary artery disease, a wax-like materials called plaque build up on the inside wall of arteries in the heart. Plaque is made of cholesterol and other cells. The amount of plaque increase slowly. As more plaque build up, the insides of the heart blood vessels get narrower. This means that less blood can flow through the blood vessel. This can cause platelets to build up in front of the plaque. This causes a blood clot in the blood vessel. If the clot break free and get stuck in part of the blood vessel made narrow by the plaque and the clot together block and the blood vessel completely. This makes it impossible for blood to get to part of the heart and causes a heart attack. Okay, it is the this is the vital cause for heart attack. So there has lot of symptoms. By this you can find out your heart problem. Signs that a person is having a heart attack show over several minutes and rarely comes immediately. Most people having a heart attack have chest pain. Sometimes people have pain in left arm, the lower jaw, the neck, the right arm, the back, or in part of the abdomen. Many women have different symptoms than men. The most common symptoms include shortness of breath, weakness, and feeling very tired. Some women feel tired, do not sleep properly, and have shortened of breath for up to a month before they have a attack. They have a heart attack. Women may also have nausea and stomach upset when having a heart attack. Sometimes people have silent heart attack. These are the heart attack that do not cause any pain. Okay, they are more common in elderly people, women, and people with diabetes. In these people, suddenly feeling very tired or fainting may be the only sign of a heart attack. Okay, and treatment, there has a lot of treatment now. A heart attack is a medical emergency that needs treatment as quickly as possible. The most important thing is to serve as much myocardial as possible and prevent more complications. As time passes, the risk of damage to the heart muscles increases. Doctors or paramedics usually start certain treatment as soon as a heart attack is suspected. These treatments include aspirin. Aspirin is an early and important treatment for a heart attack. Aspirin keeps platelets from the sticking together and can help prevent more blood clots from the forming inside the blood vessel and the heart. And nitro wins the blood vessel in the heart. This makes it easier for blood to flow through those vessels to the heart. And oxygen, if the patient is having trouble breathing, oxygen can be given. And painkiller or pain related medicine for the chest pain. Once doctors are sure that a person having a heart attack, there are two main treatment: clot busting medicine. So now I am going to say about rheumatic fever, very common disease. Rheumatic fever is an inflammatory disease that happens in children and young adults as a result of becoming infected by group A Streptococcus bacteria or Streptococci bacteria, singular and plural form you can say. The first attack usually happens between the age of 5 and 15. If affects the heart, skin, joint and the central nervous system, it is most common in the Middle East, Eastern Europe, South America and the Far East, and rare in Western Europe and North America. Treatment includes resting in bed and antibiotics. Okay. Sometimes rheumatic fever can be a fatal disease. To prevent or control rheumatic fever can be effectively and promptly treating strep throat with antibiotics. In those who have previous had rheumatic fever, antibiotics is a preventive manner as occasionally recommended. As of 2017, the evidence to support long-term antibiotics in those with the underlying disease is poor. The American Heart Association suggests that dental health be maintained and that people with a history of bacterial endocarditis, a heart transplant or artificial heart valves or sometimes of congenital heart defects may wish to consider long-term antibiotic treatment. This is a very much important part. So there has a different way. By this we can identify rheumatic arthritis or rheumatic fever. According to the revised Jones criteria, the diagnosis of rheumatic fever can be made when two of the major criteria or one major criterion plus two minor criterion are present along with the evidence of streptococcal infection. Okay, so it may be fatal. Chronic rheumatic heart disease (RHD) is characterized by the repeated inflammation with fibrinous repair. The cardinal anatomic changes of the valve include leaflet thickening and shortening and thickening of the tendinous cords. It is caused by an autoimmune reaction to group A and beta hemolytic streptococci that result in a valvular damage. Very dangerous problem for our blood circulation. Okay. The disease typically develops 2 or 4 weeks after a throat infections. Symptoms include fever, painful joint with the joint affected changing with the time, involuntary muscles movement, and occasionally a characteristics non-itchy rash known as erythema marginatum. The heart is involved in about half of the case. Damage of the heart valve usually occurs only after the multiple attack, but may occasionally occur after a single case of rheumatic fever. The damage of valve may result in heart failure and also increase the risk of arterial infraction and infection of the valves. So that's all about coronary diseases and their remedies. Hope you have enjoyed this class. If you have any question, please write down on comments box. Thank you so much.